Hello from Jo Brett. I'm occupational therapist and CEO at Star Jumps. I'm excited tonight to have Dr. Georgie Siggers, who is a consultant paediatrician, and I'm sure many of you who are joining us now or later already know Georgie. Our topic tonight is on the theme, we're on the theme of anxiety, as this is something that it has really been concerning a lot of people during this lockdown period where we're in strange times and strange territory. So thank you for joining us. Georgie's going to give an overview for about 10 or 15 minutes, and then we'll be able to look at the comments and see what questions you're asking. And if it seems appropriate for me to interrupt Georgie, then I might. But otherwise, we'll let Georgie talk for the first part, and we're going for an hour, so finishing at 9:10. So thank you very much for joining us, and I'm going to hand over to Georgie now. Thanks, Georgie.
Good evening, everyone, and I hope you're having a good week. So yes, thank you, Jo. And I'm going to try to just do a very quick introduction to what we know about anxiety in children who have autism and or ADHD. Obviously, as I'm sure you all know, it's much more common to have anxiety when you have neurodevelopmental condition as opposed to when you're neurotypical. So we think that in general about 10% of neurotypical children and young people and adults will have an anxiety at some point. And of course, anxiety in the right context is completely normal, and it is a survival instinct. You know, that it would be counterproductive if we weren't frightened of things that could potentially harm us or put us at risk. So but I think as we will all recognize, in neurodevelopmental conditions, the anxiety becomes much more intrusive. And I do feel, and increasingly so, that anxiety is anxiety is the thing that gets in the way for so many children in their ability to access day-to-day life. It's not necessarily the autism or ADHD but that are causing the issues and the worries, but it's the fact that they're there that then increases the risk of anxiety. But it's the anxiety that stops our children from being able to do things and enjoy the day-to-day activities. And I thought it would just be helpful to just start by having a think about why children with autism or children with ADHD or children who have both can develop anxiety, because if we can understand a little bit more about why it happens, then that will obviously help us to be more confident about the steps that we put in place to help them. So I'm going to just talk a little bit about why it happens in both conditions, and of course then if your child has both conditions, there's going to be two different sets of reasons, and there's obviously a lot of overlap as well. I'm going to then just talk a little bit about how it presents, because I think that's really important. I think there's so much misunderstanding about how anxiety presents in children with neurodevelopmental disorders, and I think that's one of the key problems actually, is that so many people don't recognize some of the behaviors that we see as being driven by anxiety. And then I'm going to talk just kind of very broadly about what we can do, but just focusing on really on the kind of directions that we need to think about putting in place support, and why it's actually slightly different between the two conditions, and why it becomes even more complicated if your child has both. So,
Georgie, before you start, could I just ask you to say something about the questions that people might be wanting to put in the comments? Yes,
do write down your questions, and it's obviously going to be helpful for them to be sort of fairly general, rather than if it's a very specific question about your child. So just want the session to be as useful to as many people as possible. But I'll do my best to answer them, or direct to one of the other members of the team, who I know there's, you know, various Anya's talk last night and various others that are planned, and they may be better placed to answer some of the questions, but I'll do my best to cover those things. So do send in your questions.
I might just take myself out at this point, Georgie, so we can focus on you, and I'll come back in when you're ready for questions.
Lovely, okay. Thank you.
Yeah, okay.
Okay, so what we think about with anxiety in autism is that there's really kind of two drivers that cause the anxiety. And what I'm talking about here, there's obviously lots of different types of anxiety, but I'm talking sort of more broadly about the generalized anxiety disorder. But obviously children with autism, they're also much more likely to have specific phobias than perhaps neurotypical children. And some of those can be very unusual, but they're often mixed with a more generalized anxiety as well. And why we think that happens is that generally they experience a lot of confusion. So that can stem from difficulties understanding language. It can stem from difficulties understanding non-verbal communication. So that sort of sense of not being able to decode people and what their intentions are. It comes from having difficulty actually understanding the emotions themselves and even recognizing that a feeling is anxiety, and a lot of confusion, for neurotypical people. I guess people will know what they mean by anxiety or anger or sadness or happiness. And for some children on the spectrum, that is all very muddled, and they don't really know how to associate the feeling with the words. So there'll be that difficulty in recognizing emotions. There's a term called alexithymia that covers that concept. There's difficulty in dealing with change. So the difficulty with predicting. So what we know happens with children with autism, they can't predict what is going to happen next. So everything becomes fearful. Can't look back and think, well, last time I stepped on this, it felt like this. It's nothing to be afraid of. So that can be a real block. Can find it very difficult to generalize. So perhaps something that was stressful before, you would think, so perhaps it's in relation to a birthday party. You think, well, a child might think, I coped with that at Johnny's party, and therefore it's not going to be so bad at Julie's party. But actually, Julie's party is completely different. So the autistic brain won't be able to adapt and flex in that way. So the new situation becomes just as novel as the previous one. And then there's also obviously added to that the concept about rigid thinking and things needing to be just so and not being able to adapt as quickly. So that leads to lots of confusion, which makes the world very stressful, because you just can't easily and instinctively work out what is happening around you and how you need to adapt. And then added to that, we have all of the sensory processing difficulties that Anya spoke about last night. And the two kind of overlap in a way, because again, you can't predict or generalize in terms of sensory. So anything that you with your autistic brain is anticipating as a sensory threat will go on and go on. So the two things kind of come together and lead to very high levels of anxiety. And then when we think about ADHD, it comes from a slight different sort of angle, that ADHD, the fears are, sometimes people think of the anxiety in ADHD as secondary. So it comes from chronic failure and the fear of failure, because ADHD has made you disorganized and made you get into trouble and made you do silly things, or and you sense that difference from other people. And one of the things that is very problematic in ADHD is the fear of being judged. What's my teacher going to think of me if I'm late with this piece of work, but actually then you can't really do anything about it because you're disorganized and your thoughts are all over the place. But so it sort of drives from that, but also because of a difficulty regulating those emotions. So talk about children with ADHD being flooded with emotions. So it's almost as if they have too many of them, whereas with ASD it's the kind of lack of understanding of what it all means. So subtly the two conditions present, the triggers for the autism, for the anxiety, are subtly different, and obviously if they're overlapping it becomes even more confusing. And what we know is that for children who have both autism and ADHD, the anxiety it's much more intense. It's much more common to have anxiety, and we talk about something called disproportionate anxiety, which is very difficult to overcome. So what we then have to think about is, how does it present? So with both neurodevelopmental conditions, anxiety may lead to an escalation in challenging behaviour. So not tantrums, meltdowns, aggressive behaviour as what you see in a stressful situation. With children who are on the autism spectrum, you might see an increase in the need for repetition and repetitive behaviours, or their self-soothing behaviours. You will very commonly see an increase in the need to control a situation. So a child who maybe before the trigger to the anxiety, so I think for some families experiencing this with the lockdown, that maybe before the child would be a bit more flexible about where things were in their room, and then suddenly there's a need to be very in control and things to be just so, and very particular and more inflexible. So that's a sign of trying to get that order back into their lives to address the anxiety. You'll see in children with autism a lot more demand avoidance and resistance, so the pathological demand avoidant like behaviours. You might see a child becoming much more withdrawn, so they may communicate less, they may want to retreat more. And a child with ADHD, what you might see is actually anxiety is much more overt. So child might be able to talk more about the fact that they're really not feeling good, overwhelmed with their fears and worries. You might also see that sort of more irritable, argumentative, reactive type behaviour. You might see some withdrawing from social activities. You might see a sort of a fatigue because they're overwhelmed by the constant threats and fears. Some people will describe, seeing a child, and I think this is difficult because screens are so attractive for the ADHD brain, but you might see that sort of as a coping strategy, actually not wanting to do anything else. It's just too difficult. I'm too stressed. I'm just going to focus on this. And we think of that as probably another kind of quite useful way of distracting yourself from the anxiety. And then for all children, you might see more of a impact on physical health. So you might see their appetite decrease, so they go off their food. For children with ADHD, you might see the opposite. Actually, might start to crave more sweet things as trying to sort of make themselves feel a little bit better about everything that's happening. You might see more physical symptoms like nausea. You might see flare-up of health conditions like eczema, gastrointestinal difficulties, headaches. So all of those kind of things that can happen. And I would say that what's so difficult is that if you think about a child on the spectrum who doesn't really understand the feelings as easily, and this will happen, we think this happens far more in a high functioning type of picture of autism, is that actually it just won't show in the same way as you might expect the neurotypical child. And I think this is one of the real challenges in school, where I think over and over we see children who teachers and teaching staff will say that in school they seem fine. There's no external sign of any anxiety. And yet we know those children must be highly anxious because of the way that they are then reacting at home. And those children will talk about the fact that they are frightened of school. But the way that they present is not how we would typically be thinking of somebody behaving when they're anxious. And I guess that's because we are used to certain physical signs that give that away. So maybe people talking a little bit more quickly, or being a little bit breathless, or you can they will talk about themselves, about their heart racing, and that I think a sense that we can see in people if they are nervous. But children on the autism spectrum usually don't show that sign, so it can be very subtle. And I think what we tend to find is that parents will be the ones that will notice those signs of their child getting anxious. They will absolutely know and see. They will know the triggers. They'll know that it's about to happen. They will see the subtle signs, and it's very difficult because, as I know Dr. Liz has spoken about as well, anxiety is contagious. And one of the things that we have to really think about when we're helping children to deal with anxiety is about keeping everything calm. And I just think that's one of the things that is so difficult if you're then having to really strongly advocate for your child and try to explain to other people that what you're seeing is anxiety and they're not seeing it, you know, that's going to make anybody stress, because you want to do everything that you can to get people to understand your child and make things better. But when we're thinking about what we need to do to help our children, it's really important that we keep calm, that we model that good sort of mental health coping behaviour, which is so difficult in these situations, because I think, you know, nothing else kind of fires you up more than that sort of feeling of injustice for your child when you know that something's not working for them and you want to put it right. But and equally, some of the behaviours that our children can show when they're really anxious are the very ones that will also cause us to flare and think that's not, you know, that's not acceptable. I don't want you to speak to me like that, or I don't want you to do that. And when children are very challenging and in the midst of meltdown, it's very difficult, isn't it, to keep calm. But that's something that we need to do, because if we're getting anxious and we're more aroused and stimulated, children's brains will pick up on that, and it will be even harder. It just escalates the situation even more. So I think what we have to keep remembering is for us to keep calm, keeping the environment as calm as possible, so decreasing that sensory load. Important to validate the feelings. So you know, I just think if you think about just for a moment anything that's made you feel really nervous, there will be certain situations that trigger anxiety, that are usually situations that are very kind of traditional, typical anxiety, where we are in danger, where actually it can be quite comforting for somebody to say, don't worry, it's actually okay. But for most of the anxieties that we feel, if somebody says that to you, actually it's the worst thing. Is, you know, if somebody says, oh, don't be silly, you know, calm down, there's nothing to be worried about, I think probably for lots of people it just makes you, it's a catalyst, it makes it feel worse. So I think we have to try to avoid that, responding in that way, to actually to validate what your child is feeling. And I think that's particularly important with children with autism, is so that you can help them to understand that feeling, and you can keep explaining it and keep reinforcing that's what they're feeling. But obviously it's getting the balance right as well, because then you can go the other way. So I think, you know, if you know that your child is anxious, you may be wanting to check in with them all the time. If you know that they're in a situation that stresses them and makes them fearful, what you don't want to be doing the whole time is, are you okay? You know, is everything all right? You know, are you feeling, how are you feeling? Because that can also put too much emphasis on this. So I think getting the balance is really important and not easy. But very important not to dismiss how they're feeling as well. And I think, again, particularly with children with ADHD, because that could flare up things very quickly. With children on the autism spectrum, what we want to do is to give clarity. So we want to make the world more predictable for them. But that has to be carefully balanced with, we can't completely remove any possible threat or change. It's just not possible. So at the same time as making the world predictable for them, we've actually also got to bring in change at times when we can see that they can cope with it, so that they can build up their resilience to that. So people will talk about bringing in a positive change. So it might be, if your child is very rigid about routine, that actually you're changing it, but you're changing it in their benefit. So actually it's like, oh, you can have 5 more minutes of screen time, or you can have 5 more minutes of this activity. So it's introducing the change, but it's in a way that there's a real benefit for them. So that will help them to acclimatize to that. But what we really want to do is make the world more predictable for them. So structure, routine, lots of explanation, reinforcing things with visual, teaching them to understand more of the communication and people's intentions. So through their body language, teaching them about facial expressions and changes in tone of voice, teaching them about those subtle things that people that we just, so many of us take for granted, that we just know. So I was reading something recently about the different ways of saying sorry, and the different meanings around an apology. That, if I just do, oh, I'm so sorry about that. It's not the same as having to go and apologize for something that's really difficult that you've done, that you're ashamed of, and you know that. So that, but so many of these things we just assume that people will understand the differences, and they come to us instinctively and we learn them naturally. No one has to teach them, but actually for our children on the spectrum, we've got to teach them those rules. So making the world predictable by teaching them the things that they are not instinctively understanding. So lots of visual supports and pictures to explain things, lots of preparation for change, but obviously that's going to be, you'll know with your child whether, you know, how much preparation they need. So for some children, really important to have as much time as possible to plan and prepare for things, but for others that leads to more time to worry about it. So it might be that you know that you do have to do some preparation, but you do that in a shorter time frame. And then thinking obviously about the teaching and of the understanding of emotions. So actually helping children to understand that what they are feeling is anxiety. The default emotion for children who are anxious with autism is very commonly to be angry. But so what we see is anger, but actually what they're trying to tell us is that they're afraid, they're frightened. This is anxiety. So helping them to work out what it is that they're, you know, to keep reinforcing that this is a worry, and helping them to recognize that through sometimes it's easier through the physical feelings that they get. And so with children on the autism spectrum, almost what you're trying to do is to help them, you're trying to help them to recognize the anxiety and find ways to respond to it. Whereas for children with ADHD, it's almost as if you're trying to help them to actually find ways to reduce those emotions, because it's all fired up. So what you may find will work with a child with ADHD is the sort of stop, think, it's okay, let's break this down. What is it that's really worrying you? We can break this down into steps and we can come up with a reason why that doesn't have to be so stressful. And children who have ADHD without the autism will be more amenable to the generalization. So you could talk them through if they're very worried about a party that they've got to go to, or a test. A test is probably is just reinforcing, when you did that last year or you did that last term and you managed, and this is no different. So they may be able to feel better through that kind of approach, but that sort of approach is not going to work as well for a child with ASD. And so with ADHD, it's more kind of teaching them to manage those overwhelming feelings. Whereas with ADHD, whereas with ASD, it's more trying to help minimize the triggers and help them sort of recognize it more. So there's two slightly different approaches, but with this common theme of trying to keep as calm as possible and the environment as low arousal as possible. So that's my kind of very brief overview of anxiety in children with autism and or ADHD. So I hope there's been some questions by now.
There has been lots of great questions and comments, and that was amazing, Georgie. I always learn so much when I hear you talk, and especially on this subject of dual diagnosis and the complexity of that, because you have so much experience and knowledge in this area. It's always fascinating, as somebody's commented, to hear your insights. So the questions that I'll go, I'm scrolling up so I can run through them. Somebody's asked a little bit about PDA, and does this require a different approach to anxiety?
Yeah, so
or to other types of anxiety.
Yeah,
Sorry.
so I mean, PDA is, as many of you will know, is very controversial because it's not recognised as a formal diagnosis in our diagnostic manuals, but it is very important to recognise it as a behaviour pattern. I personally feel that there's a true PDA, and then there's which is rare, and then there's more of a children adopting PDA type behaviours that are usually coping strategies for high levels of anxiety. And the reason that I feel confident in that sort of hypothesis, and then I'm not unique in that. There's lots of colleagues who will also have that kind of understanding and take that view, is that I see PDA levels and behaviours come and go. So I particularly see that in the children that I see regularly who have autism and ADHD and anxiety. And it's often, it's multifactorial, but there'll be some kind of change that we've managed to get in place for the better. So sometimes it might be through ADHD medication, or it might be through sensory integration therapy, or it might be adaptations at school, or something you're doing differently at home, but it will be something will have led to an improvement, and it's usually a little bit of everything. And then you see a child who becomes more flexible and less demand avoidant. But I think you can also recognise that in your children sort of day to day in different settings, that you'll kind of start to anticipate and probably already know that there are situations where they're going to be much more demand avoidant. And I think that it is really important to recognise it, because if your child has got to that sort of anxiety level that they have, that's their coping strategy, I feel that that's a really dangerous sign. It's like, I can't take any more, my hands are up, leave me alone, don't ask me to do one more thing. I think we can probably all understand that kind of feeling. I think a couple of days ago when I looked at my emails, I felt a bit like that. It's just like, please, no more. Anybody ask me to do something, I'm going to have a meltdown. But I'm making light of this, but I think you can understand the response, and I think we need to take that behavior really seriously, because that's your child saying, I'm not okay. And so actually, if you give any more demands, then you're just going to make things worse. And it's really important to recognize that. And I think people feel really scared sometimes about doing that, because they will be told by everybody else, you've got to be firmer, you've got to do this, try this, you're not being a good enough parent. When actually what you need to do is you trust your instinct that actually you've got to take all the demands off. But we are hardwired as parents to control our children. Our children do what we say, when they do what we want, when we want them to do it. And so it feels very uncomfortable to give up that control. And obviously you've got to still do it within the parameters of keeping your child safe. But actually, if it works if you take the demands off and you just let them be and let them do what they need to do for a little bit. What you'll probably find is that then the situation improves, so you can go slowly in with the demands. But if you go in too soon, you'll just get the resistance.
Yes. Last night when Anya and I were talking about sensory processing, we see so many children that have really big challenges with their sensory systems. And a lot of the children that we see who have those difficulties can be very, very challenging and not want to cooperate with any request. And I think, what you've said about that, Georgie, is really,
and I think one of
really
the ways
true.
that you see the difference is, so I think, and this happens an awful lot with children who are completely overwhelmed by the demands of school, is that you'll see, and you probably already, many of you will have children who adopt this pattern, where things become so much better in the school holidays, and perhaps even at this time with lockdown, you'll see things that your child is able to do that are your requests that previously they wouldn't have tolerated. And that's what I mean about the PDA like behaviors coming and going depending on the environment. Whereas we do have children who, when you take all the demands off, so you get to crisis point, you take them out of school, you're going to home educate them, that actually it doesn't, might get a little bit better, but it's not the magic cure that we perhaps anticipate and hope for. And then you get the added, and this is where the true, I think, kind of true PDA is, where the child is jeopardizing the things that, they start to not do the things that actually they really enjoyed and want to do. So they're kind of self-jeopardizing. And I think that to me is the kind of real entrenched PDA, and that's it's very, very difficult to know how to help. And I'm not, that's where the PDA society strategies can be very helpful, but I think it's just such a complicated and complex situation.
Yes. So we could talk about it for much longer, I know, Georgie, but in order to get through some more questions, thank you for that question. We've got a question about therapeutic support for anxiety around social situations for children who have autism and what we would suggest.
So I think first, I sort of feel with these situations, you need to be a detective at the beginning and sort of work out and try and work out. And obviously, it's not always easy, but what is it? Is it what's driving this? So when children with autism are very anxious in social situations, it will tend to be driven through that kind of confusion of what to do and a feeling almost of not knowing what to do in the situation. But it's more driven, sort of, we think, by the lack of instinctive understanding of communication and expectation, rather than, so children with ADHD can have a lot of social anxiety, but that's more driven by the fear of what people are going to think of you in that situation. So that if you think about the differences, and obviously for some children they have both, so it becomes even more complicated. It's trying to work out, and obviously it does depend on the level of communication ability your child will have, but trying to get some clues about what it is exactly that is causing the fear. And obviously for them, they may not know. So it's for you building up that kind of intelligence through the signs that you see, and when do things seem to be so much easier. And then there is something called a stepladder approach, where you set a goal. So maybe it is to go to a party with some school friends, and you break that down into much smaller, manageable steps. And there's some amazing work where people then are using. So I think using a child's special interest for any of these approaches is really helpful and powerful. So sometimes it could be a very visual stepladder, but it is graded. It might be the spines on a dinosaur. I've seen that as well. So that's playing to that and interesting and motivating that child. But then you break it down. So it might be that the first thing, there's lots of different examples, but it would be one very small step to that situation. So it may be, so if it's going to that party, it may be that actually you just drive to the venue of where it's going to be, and your child just sees it, and then maybe the next time your child gets out, and maybe another time they go into the door with you, so but that every step is really carefully scaffolded and lots of explanation beforehand, so they know exactly what to expect, and lots of reinforcement. But it obviously does depend on the individual situation and what it is that's causing the anxiety.
Absolutely. Social stories, which I know Liz is going to be talking about next Wednesday at 8 o'clock, our speech and language therapist. And it's something we touched on yesterday. They can be really helpful, where
Yes,
you're able to talk through
absolutely.
situations.
So social stories, the comic strip conversations, the drawing out what to expect. And I think for slightly older children, actually coaching, because sometimes it can be, and if they can explain it to you, that they may say, I just don't know what I'm going to say. So that's the thing that sort of paralyzes them in these situations, is the fear. Somebody might talk to them and they don't know what to say. So actually, and I'm sure Liz will cover that, but the coaching, having some conversation starters can make so much difference.
Absolutely. So we've had a question about primitive reflexes, but I think it's already been mentioned that occupational therapy assessments do look at primitive reflexes, and Georgie, in your physical examinations, you will be looking at that kind of thing as
Yes,
well.
but I'm kind of looking more at the physical, it's a sort of muscle tone, reflexes, power. It's a slightly different things that
Yeah,
I
so as
think
OTs, we do look at retained reflexes, and sensory integration can help with those. So we do look at that. But I think the comment was really that they're not often considered. And I think, it's a valid comment, because if a
yeah.
child's got some retained reflexes, this is going to um, affect them, because some of those are sort of reactions to threatening situations as well. So any tips for getting a child out of the house if they don't want to leave to go and do exercise? I need some for myself, actually.
Yeah. Again, I think trying to get a bit of understanding of why that might be. So it can be quite a common situation in ADHD, is sort of fatigue, kind of. So it might look like, I can't be bothered, and I think children with ADHD can very quickly be labelled as lazy because they kind of lose that motivation. They can't drive themselves to do that next thing. Whereas we would typically think of children with ADHD as boundful of, sort of so much energy that they're bursting out of the door. But especially as children get older. But I think sort of through distraction, because I think sometimes it is the transition, isn't it? And it's the thought of it. So I think through making it having a different purpose, so you're actually going out to do something else, so that you kind of, it's not I'm going to make you come outside with me and do exercise, but let's go and do something fun that kind of gets you out at the same
Maybe you
time.
can park a bit further away from the place you're going. I mean, I know there aren't many places that we can go and visit right now, but
Yeah, and again, playing to your child's strengths and interests, what it is that will motivate them. But I think also understanding what it is, because there can be so many different things. Is it a fear that they're going to see somebody that they don't know who might talk to them? So preparing them for that and what they could say, and the fact that they don't need to say anything, or thinking about ways that they could overcome that. Or is it sensory? Is it going to be too bright out there, or is it going to be too noisy? Is it going to be too windy? So thinking about what the things, and obviously for many children there'll be lots of things that will be playing
and
into that.
sometimes doing, like we were talking about yesterday, some sensory activities to alert a child a little bit. So jumping on a trampoline, or bouncing on a ball at home, just sitting on a bouncy ball, to try and kind of wake up their body, so that then they might feel a bit more energized to be able to go and do a little bit of going to do something. I think what you're saying, Georgie, about having a purpose and something that they're really interested in is really good. But on the other hand, we do appreciate that sometimes you need your child to go with you for just doing
Very,
things.
very
Yes.
difficult.
So somebody's asked about helping to boost the positivity of a child with ADHD, that a child can feel like they don't fit in with their family, or they don't, nothing's really working. That kind of boosting. Somebody in the team, I think, has said that the ADHD Foundation have some lovely sensory stories about ADHD superpowers. And I know, we often talk about superpowers, and some short videos about sports people and celebrities who have ADHD to sort of help.
Yeah, I mean, the ADHD brain is such a brilliant brain, but I think it's a brilliant brain to have as an adult, and it's really hard when you're a child, because our environment is set up to kind of squash you, really. And so many children will they feel failures, and actually that you can see why, because they'll be in trouble at school and they don't really understand why, and there's nothing they can do about it. They're constantly told to sort of improve, and it's not it's not that they don't want to, it's just that they can't. So they're very at risk of being misunderstood. They can be very challenging, frustrating children to parents. So we will get cross with them at home, and sometimes inadvertently reinforce that message that that they're that they feel that they're always in trouble. And then friends will do the same. So friends will often get fed up of a child with ADHD. So the very boisterous, hyperactive children can get annoying because they don't kind of know when to stop. But equally, the ones who are kind of who are very inattentive, who don't really give time for their friends to respond, and they're they're daydreaming, they look like they're not interested. So there's so many factors that make them feel so low. So I think just trying to reinforce the message that it's a great brain. So there's some lovely ways of describing it, but I like the your really fast shiny car, it's just that your brakes are bicycle brakes, and we need to try and strengthen them. So that's I think a nice one, but reinforcing about all of the very successful people with ADHD, all of the ADHD brain is amazing brain, and you can so quickly switch. There's a lovely poster that is also, you can find it on the ADHD website, ADHD Foundation website, where they take every symptom of ADHD, so it's kind of being distractible or it's being impulsive, and switch it. You're impulsive but you're inventive, you're creative, you're a multitasker, you're passionate, all of these things, and that's so important. And then lots of praise for everything that goes right. And that it's really tedious and it's really hard work to praise the positives and ignore the negatives, but it's a very powerful support for children, particularly for children with ADHD. And there's some very strong evidence. ADHD children will hear negatives 10, 20 times more than they will hear positives. You've got to really redress, and that can be what they take in as well as what we're saying, but we're all so much better at stepping in and giving attention when things go wrong and not rewarding the positives. And there is absolutely no evidence that negative sanctions or punishments work in ADHD. You can't change your behavior. You could threaten to take away your child's absolute prize possession in an attempt to try and get them to control an ADHD symptom. It won't work. It will just make them feel rubbish. And that's something that many teachers recognize that really clearly, and they don't do that. But still, even just this week, I've been hearing about a child with ADHD who's still getting detentions, obviously pre-lockdown, but detentions and isolation. It doesn't work. It just reinforces the negative.
And sometimes something as well, like at the end of the day, it's really nice to ask your child, let's think about 3 things that went really well today, and what did you really enjoy about today? So the end of every day is sort of ending with something really positive that they can, and even writing them down, having, let's think of 3 things to put in our gratitude, or our, it's been a great day or something. And for older children, having a sort of gratitude journal of all things that have gone well, and what, how, think of the things that they feel happy about, having a nice supper tonight, or I made dad really happy when I did this, or I
and
was really
equally
proud when I did that.
That to them. So particularly if it's something to do with ADHD, is take the thing that maybe the child is getting very upset about. So whether if it's impulsiveness, and you can see why children with ADHD get so anxious about these situations, because they kind of know that there's not much they can do about it. They're stepping into a situation, particularly in school, where they're just going to get in trouble again and again. But taking that troublesome feature and actually kind of switching around, saying these are the things that I really love about you. The fact that you've got this energy, the fact you've got these, you're full of ideas, you're inventive, you're creative, so that you are empowering them to actually, because at some point they've, I think is so powerful to love those bits about you.
Absolutely.
But when you're a child, it's so difficult.
So we've got lots more questions, Georgie. Somebody asked about medication, but I did say that that's a very difficult thing without lots of information about a child, and I think it's not really the right place here to be able to
and I would just sort of say generally that it's so important to put in place all of the other strategies first and really get an understanding of why, because otherwise you're at risk of not treating the cause and treating the end symptom. And obviously
Absolutely.
for some children there is a place, but it has to be very carefully considered.
And this was a question around a 14-year-old, so who had been taking some medication for some time. But again, it's very individual. But I agree with you, and I think that's something we feel very strongly at Star Jumps about is looking at what might be happening, and really trying to address those things. Yeah. So a question about school and a child, 7-year-old, being very anxious about going to school or leaving the house for anything, is able to access school 95% of the time after about 1 or 2 hours of negotiation beforehand. So her mother knows she's very anxious about lots of things about the school in a class of 30, and she's mostly coping and happy. But could the long negotiations and arguments of up to 2 hours in the morning be more damaging in the long run? Or are school right, and it's fine to keep making her keep going? And there's some not diagnosis but suspected maybe ADHD, autism, PDA. So
Yes, I think that this situation of children really struggling to get into school in the morning, and then often playing, you seeing the impact of a difficult school day, or all of the effort of being in school and holding everything together, then comes out with very explosive behaviour at home. It's a very common pattern that we see. Sometimes, it's very distressing to hear of the extreme nature of what's happening in the morning, and sometimes children being teachers coming, and you can see everybody's trying to do the best thing, but actually sort of taking a child and sort of forcing them into school, and the distress that must be causing. And I just think this is such a difficult area. I think it's really important to work out what it is that's causing the distress and the fear, and what you can do about that. So what adaptations can be made, because there will be a reason. We are, again, kind of, for most of us, hardwired that we go to school. We don't, it's okay. We might not necessarily enjoy it, but it's not normal to have that level of school resistance or fear. So trying to work out what it is. I think that the decision to kind of give up on that is so difficult. It's so individual. It would very much depend on what has been put in place, what hope there is of making changes. I think once you make that decision, it's very difficult to then step back, and sometimes it might be that you can see that actually for medical reasons you can't kind of carry on. This child is actually ill through the stress of what's happening to them, but it has to be really carefully thought out, because I can also see, I've also, for just as many children as I've kind of seen the absolute sense in saying enough is enough, I've also seen children where, with persistence and adaptations and that kind of just keeping going, they can overcome some of the difficulties. So, and what you don't want to do is to step in too early and not let that happen, because I think it's then very difficult. It's a much steeper ladder to climb up. So it's very difficult. And I think also that in those situations, so important again is to be thinking about how you're managing it yourself, because I think for it's a nightmare situation, isn't it? And you parents must be feeling extremely anxious from the moment they wake up, knowing that that's going to happen. And then how do you deal with that? And what can you do to make sure that your own anxiety, which I think it would be a completely natural and normal response to that situation, doesn't inadvertently make that situation worse. And I think we need to be very careful about some of the messages that are given to parents, because I do meet lots of families where they're given the impression from professionals that the professionals think it must be something that they're doing wrong. That's why their child is resisting school so much. And I'm not saying that at all, but I'm saying because I really truly don't believe that parents can make their children phobic of school in that way. And why would anybody do that? I think the fear comes from the child, but I think that there are escalating factors and exaggerating factors that can happen depending on how we as parents manage that situation. And there's so much of this that we don't understand. I wish I had answers, because I've got so many children where the situation is so dire and so the anxiety is sort of so seemingly disproportionate, and actually parents are doing everything possible, and I have the greatest admiration for them in the situations that they're dealing with. And sometimes they are in situations where nobody else seems to believe what they're experiencing, and seems to think that there is exaggeration or fabrication. And then other situations with children where they seem to be coping. And I wish I knew what the different, why the difference, but I don't. You can see some patterns, and there's sometimes, I think, children who are able to show their anxiety a little bit more in school, or they are able to show the challenges. So sometimes kind of children who are acting out in school and maybe a bit more, there might be some challenging behaviour, they tend to not have so many of these difficulties pre and post school. But it's very
It's
difficult.
really tough, and but there are some schools that we've worked with that do amazing adaptation to the day, the day in school, that really helps to bring down anxiety in
Yeah, I mean,
children.
so many wonderful
To be
things
more of it.
here,
Yeah.
of being able to, and sometimes they can be very simple things. It's just being schools being flexible to allow them, but where a teacher comes out and meets you, but not in any kind of threatening way of trying to get you into school, but maybe to distract you. That I heard a story the other day about school dog coming out to
Lovely.
to
Yeah.
meet you, to help you to get in, or having a particular job that's then your responsibility, and you might have to go in early because it's your job. So actually that doesn't, you're different in an important way because you have a responsibility, but that also means that you can get into the classroom before everyone else joins. And sometimes from a sensory perspective, it's easier for the bustle to join you when you're already in the environment than walk into it. So I think there's lots of clever and creative ways. And I would say my strongest message in these difficult situations, from kind of years of being party to it, is that the relationship you have with school is so important, because you have to work together as detectives to find the ways that are going to help. And the really sad thing is that so often the relationship between parents and school breaks down, and I think that's often because there's a kind of judgment and misunderstanding about what's happening. And that would be my kind of message I want to get out there, is we have to all trust each other. And I think it's very difficult, because if you have a school teacher saying, well, they're fine in school, I think our natural instinct would be to think, well, you're not doing your job properly, you're not noticing, why are you not seeing that my child is struggling? And I actually genuinely believe that some children just don't show it. But then that mustn't be translated into, this is a problem with parents, this is a problem with home. We have
being in school
to
for
have
a
more
children.
awareness of, this is neurodevelopmental, this makes sense, this is a story we hear over and over again.
It can be like a pressure cooker for a sensory sensitive child, and it builds up, and then they manage to hold it together until they're at home, and that anxiety about how they're going to feel at school beforehand is just so intense, but the teachers may not
and we just have to be so careful not to judge. The feeling of relief I get when I get information from school where I get a teacher making a comment such as, child appears to be coping in school and isn't showing any obvious signs of anything, but I know that the situation is very different at home, and we understand this and we're trying to support, as opposed to parents think there's something wrong, we don't see anything. You kind of, it's just the when you read the wording, you can just, it immediately worries you about how is the situation being misinterpreted. And I think we have a very important job to do to raise awareness about these situations.
I'm aware that we've got 5 more minutes and we've got quite a lot of comments, so I'm going to see if we can. Somebody's asked if autism and bipolar can run alongside each other, or is it normally one or the other?
So bipolar disorder in children is extremely rare. Doesn't not exist, but it's rare. And I think that what we're recognizing more and more is that children who would kind of seem to have that kind of on-off or up-down type of presentation, it's much more likely that that is because of ADHD and autism rather than autism and bipolar. And there's been some very interesting research looking at adult women with a bipolar disorder diagnosis that they've got earlier in life, so usually kind of in their 20s, and then they've screened them for ADHD when they're in their 40s, and at least 40% actually had a misdiagnosis of bipolar and were ADHD. And because ADHD is a very kind of up and down condition, and I think that yes, if your child has autism and then you're seeing a really kind of inconsistent type pattern, that would be a suspicion that it'd be much more likely that ADHD was the coexisting condition than bipolar.
Yeah. I've just spotted a great question from Rosie. When would you say that, that therapeutic intervention might not be enough and you need to consider medication?
It's difficult. I think it's a sort of, I wouldn't say it has to be a last resort, but I think it's sort of very individual situation, where I think what you've got to do is you're balancing risk and benefit, and there's no medication that doesn't have a risk associated with it, but it's when you can demonstrate that all of the other things that you've considered and that you've put into place have not had an impact. It's sort of what's the next thing that you can do. But I think that where I feel that it's very important to make sure that, and this is going to sound very obvious, but that you know what you're treating. And that's actually not that easy in these very complicated situations, because there's so much overlap between anxiety, ADHD, autism. So do you treat the ADHD first? Do you treat anxiety first? And if you treat anxiety, you can make ADHD symptoms worse, and if you treat ADHD, you can possibly make anxiety worse. So you've got to really understand what the things are that are driving, and that can be very difficult, because depending on how a child is presenting, how old they are, what's going on. So I think when you've tried everything, and this becomes the kind of next thing that you want to explore.
And sometimes, Georgie, would you say that the medication can just help a child to shift in some of their behaviours and their coping, so that then change can start to happen and they may not need to always be on for long?
I think that's particularly so with ADHD. So I think there's a lovely sort of thought about mindfulness and ADHD, and I really I think mindfulness is absolutely brilliant, and I think is a really good strategy for helping with anxiety and helping with some of the stress that our children are so loaded with when they have neurodevelopmental conditions. But if you have if you have uncontrolled ADHD symptoms, sitting and doing mindfulness is not really going to, it's going to be another stress. It's going to be another thing. It's a bit like exercise. Exercise is a brilliant treatment for ADHD, but actually, can I get myself out and running? No, I know it's going to help me, but I can't do it. So then it becomes another stick to beat myself with, and I'm already beaten up by school and by my friends and by my parents. So then it's another, and that's going to be like, oh, I can't even stick to mindfulness, so I'm a complete failure. Whereas actually, so that might be a situation, and obviously depending on all, weighing up all of the risks and benefits, where ADHD treatment might be the thing that then allows you to have the concentration and motivation to stick at some of these things and it to be successful. So, and then what you see is, you don't just see, so you get, it's not that the ADHD medication itself is making a massive change and suddenly taking all of these things away, but actually it might be it's the mindfulness that's doing that, but you could only access the mindfulness because you've had the symptom control, or it might be that it's something else that you're doing that you get the real benefit from, or it might be the fact that actually suddenly, because you're not in trouble at school and the teacher's giving you more praise, that is what boosts you. So I think it's part of this kind of 360-degree approach that we like to think about for children, but it at the right time and obviously carefully considered. And it's not everybody's choice, and that's something that we have to respect. And I always think that my job isn't to persuade people to start their child on medication. Absolutely not. It's to give you the right information if that's something that you want to explore.
Yeah,
and so
I know
you can weigh up risk and benefit.
that you also look at sort of nutritional and those kind of things that may be a route that some families like to try first. And we have got Dr. Liz Corcoran, who is a functional medicine practitioner that can help, and she has a background as a psychiatrist, so very knowledgeable about anxiety as well, and Abir, clinical nutritionist. So sometimes there are a lot of therapeutic and lifestyle and nutritional changes that can make a really, really big difference.
Yeah, absolutely. Yeah. And I think we have to think about all approaches really, and some will seem more obvious at a particular time in a particular context, but that it's important to consider everything. And and I can't overestimate the importance of sleep. I think we all know, don't we? Good night's sleep, things that you've been stressing about or you're getting worried about, you can have so much more clarity in how you approach that. So actually it might be that we've got all of these things going on, but the big thing that is causing everything to be so much worse is the fact that your child isn't sleeping. So if we can get sleep, and there's these fundamental things we need to get right before we think about the next step.
Yes, that's really helpful. I'm aware that maybe we take another 5 minutes, Georgie, just to...
Yeah, that's fine. Yeah.
There's been a lot of questions about children being resistant to doing anything that might help, that we know possibly might help them as a strategy, or resistant to schoolwork, or just the general resistance to trying things or doing schoolwork at home at the moment, that sort of thing. And I know you've talked about it quite a lot already. I don't know if there's anything else you want to say on that.
Well, I suppose it's just asking the question why, because let's say that most children want, and the most neurotypical children, but also children with autism and ADHD, they want to do well. They want to please us. They don't want to not do what we're asking them to do. So if they're resisting, it's why. And there will be a reason. It's just they may not be able to explain it to us, and we might be having to be the detective to work it out. But I think with schoolwork, it's often the fear of failure. So how do we model that it's okay to fail? And I think there's some lovely kind of work around, modeling that. So making mistakes and laughing about it, and pointing it out, and that I've just made that food and doesn't it look horrible, or I've made a mess with that and it's fine, it still tastes nice. Or there's so many things that we can just naturally reinforce. But I think we also can sometimes, and it obviously depends very much on our characteristics, but if we're also perfectionists, then we'll be reinforcing that fear of making mistakes, doing things wrong. So I think just having just thinking about what, and trying to work out what it could be. Is it that I'm just so overwhelmed with life at the moment that I can't do anything, and I can't even do anything, I can't even actually play with a toy that I previously enjoyed playing with, because I just need to be left alone and recover for a little bit. And or is it actually, so this can sometimes happen with ADHD, is actually I'm feeling kind of so out of sorts that I need the fight that I'm going to get from mum by refusing to do what you want me to do. Actually, that's going to be great fun, because I know that you're having a bad day too, and you're going to blow your top, and there's going to be drama, and then dad might get involved, and then younger sister might get involved, and it's going to be really great. And actually then I'm going to feel better, and I'm going to leave a wake of destruction in my path, but I'm feeling okay because everything has exploded. So I think we have to be aware of those kind of situations as well. So sometimes a refusal is as a trigger to make a drama. So trying to just work out why it might happen, why it might be happening, modeling that, whether it's okay to make mistakes, modeling your own, saying sometimes about, you might be frightened about doing something, but aren't I being brave? But making children know these are all normal feelings, and we've got ways of dealing with them. But also knowing to read the signs of when actually this is a sign that my child is just overwhelmed and just needs to go and do something else. And I do think at the moment, I was reading something at the weekend saying, we have not made a choice to home educate our children in the lockdown. This is an emergency situation. It's not something that we have planned and weighed up the pros and cons of home education. And actually, yes, I think it's important, particularly for children with neurodevelopmental conditions, to keep in a routine and try something, but you've got to weigh up. And I don't think that my personal opinion is I don't think any child is going to come to harm from not doing any learning during this period. And actually, there's so much you can learn from fun things,
Absolutely.
through. And I was talking to a mum a couple of weeks ago, and she just said, I'm not going to do any of this home learning. I'm going to just spend this time allowing my children to be children and just to have fun. And I just thought, actually, that there's so much strength in that. But I do, there's a balance in keeping children in the routine and keeping them stimulated and active. But I think we must take pressure off ourselves, because we haven't chosen to do this.
No, absolutely. And quite a few comments are saying that children are absolutely loving not having the pressure of school and really enjoying the time at home, which is great. Rosie's asked you a question, and I'm not sure if this is going to be one you can answer quickly, but where do you draw the line between neurological differences and mental health, or do they cross over from a scientific point of view?
Oh, Rosie, that is a
Yeah,
great question.
it is a really good question. So I thought it
Yeah,
would.
and I would say that it's got to be impact on functioning, really, because I think neurodevelopmental difference, I think, is a positive. And that, when we talk about embracing superpowers and the fact that we're all different, but these conditions, they do have strengths associated with them. And there are so many. I mean, I do meet some of the most remarkable children who are, they've got something, they absolutely have something to teach us about the world. And it doesn't necessarily, I'm not saying that they would be the most high functioning, but even some of the children who have intellectual disability will see something different in the world. And so I think there's so much that's positive about that we need to focus on. But where something crosses into a mental health, I think, is because it's limiting your ability to function at your potential day to day.
Yeah.
And so that's where I think, with school resistance, refusal, I don't think school refusal is a good name for it, but I think that kind of overwhelmed by school that's a medical mental health condition. That's not a difference. That's something is not going right in that child's environment.
And I think there's so much we can do early on for children that we see to prevent secondary mental health conditions from developing, and things like school refusal and then social isolation and feeling academically that they've failed, when actually, given the right support, all those things may not have to happen.
Yeah. And I sort of feel that, there's so many different arguments about what is anxiety just part of autism, or is anxiety a side effect of autism, or is it is it a sign of when the management of autism isn't going well, or the environment? And I definitely don't, I think anxiety is separate. I think it's much more of a problem than the neurodevelopmental difference. So the anxiety is the mental health problem, but we have to understand where that comes from. But I meet many children on the autism spectrum who are not anxious. They're functioning and enjoying life. There's usually the difference between a child like that and a child who is absolutely fraught and doesn't want to go to school, is the kind of awareness of how other people are perceiving them. And that's where I sort of feel that we have to be much more aware of ADHD, because ADHD is the thing that is more of a fire to worry about what other people are think about you. And sometimes there's a lovely kind of feeling of children on the spectrum being almost oblivious to how they're perceived by others. And I think when I see children like that, it just makes me feel really happy and reassured, because we can see that they're different. And sometimes they're the children that would stand out as the most different, but actually they're really comfortable in their skin. But I think there's something about them being a bit blinded to what other people are thinking about them. And I think that's such a healthy, positive characteristic to have. But I think that's what we want. And I think the problem is there's so many children that so desperately they feel different, they don't want to be different. And how do we help them to know that actually it's great to be different? And I think that's the challenge, isn't it? Because if we could do that, I don't think they would feel as anxious.
Yeah, there's a very interesting question about ADHD medication and melatonin, that somebody's been advised that melatonin may interact in a not a good way with ADHD medication, so they have a child who's bouncing around all night. And I don't know if that's anything that you can comment on, or whether it's too specific and complicated and depends on the individual.
Well, there isn't any pharmacological reason for interacting it. What can, some children can be very sensitive to the stimulant nature of the medication, and if it's given too late or it's too strong and it's lasting into the evening, it can keep them awake. Absolutely. So I always think of that as a little bit like, some of us can't, I could drink 10 cups of coffee at midnight and I would still be asleep within 5 minutes of my head hitting the pillow. But other people, and I've got friends who can't drink coffee in the afternoon because it keep them awake all night. And it's a similar situation with impact of stimulant medication on sleep. So that it may be that the wording that's been given to someone in the explanation is slightly misleading. It's not that they're interacting but it might be it's the ADHD medication that's keeping the child awake, and that meaning that there maybe the melatonin isn't working as well, because it can't overcome the fact that your child is wired from being sensitive to the stimulants. But I'd go back to your pediatrician or psychiatrist and say this isn't working, and see what they can suggest to adjust, because sometimes it could be timing, or it could be trying a different type of ADHD medication.
So using melatonin, which if you don't know, melatonin is used to help with sleep, generally shouldn't have there's no contraindication to use it with ADHD
No,
medication.
no,
No,
no.
that's really
But what you
helpful.
don't
Yeah,
want to be doing is you don't want to be
yeah,
giving melatonin. Isn't if so. The thing with melatonin is that it's very good, but it's not sedative in any way. It helps. It's trying to replace a hormone that, melatonin, that we naturally produce as it starts to get dark, to help us feel tired, and it's not going to overcome your brain being stimulated to be awake. So that's why it's so difficult with screens, because so much evidence that the light from screens interferes with your melatonin production. So if you take melatonin and then go and watch a very exciting film, or play a computer game, or even kind of go and have a stimulating conversation with someone, it's not going to work. So and there's no point taking it if it's not going to work. So I think it's just that there isn't any kind of interaction with the ADHD medication.
Thank you. I think we're probably just about out of time there. I'm really sorry if anyone here has asked some questions. I know Georgie in the future will be doing another talk on autism and ADHD, and so we will look at any questions we've missed and make sure that we can come back on anything. But I think a lot of them we've addressed. So thank you, Georgie.
Yes, and if do make comments about if there's other kind of topics, or if this has been helpful and you'd like us to do this again, we can do that. But guide us. So we were, Joe and I were talking earlier about maybe having a session once we know what's happening with schools, about kind of challenges of going back to school, because I know it's going to be very difficult, especially for children that are really loving this time. So I think something that we could do around that. But if there's other things,
absolutely, other things
you
you'd
would like us or any member of the team to talk about, then please let us know, because we're getting quite used to it now, aren't we? It's not so second time around doing it. It's not as daunting, actually.
If you know other people who might find this helpful, then please do share this information, because as we're coming online to do these, hopefully we can help more people who will be able to learn from Georgie's wisdom. And I loved what you were talking about, being detectives. It's working with parents and teachers. And
I have learned, I can honestly say I have learned far more from what your children tell me about things that are difficult, than I did in medical school, that's for sure, in terms of these conditions. So, we have to listen to what children are telling us. It might not just be through their words, but through their behaviour. That's how we can build up the knowledge of what's happening.
Absolutely. So just to let you know, next week on Monday, we have Abir Hamza Gudeka, who's a clinical nutritionist, who's going to be talking about diet and nutrition, and how making changes in what your children might be eating, and the family as well, can make really big changes in behaviour and in children who are experiencing anxiety. And that's at 8 o'clock on Monday. And on Wednesday at 8 o'clock, we've got Liz Van Gran, who's going to be talking about anxiety and children who have difficulties with communication and language and social anxiety as well. So those will be good, and lots of other resources we'll be putting out. And our play therapist Pete Nord is going to do a play therapy in action demo. I think I'm his
really
subject for this particular one. But and the following week we're looking at sleep, and Dr. Liz Corcoran, we're hoping we'll be able to do something on sleep. I think Georgie's very busy, otherwise we'd have Georgie as well. But I know your Zooms are non-stop Zooming, and your virtual work is very busy at the moment.
Yeah,
So we're really grateful for your time tonight, Georgie.
no,
And
that's
there's
a pleasure.
lots and lots of comments thanking you and saying how helpful this has been. So, and thank you, all of you who've joined us and asked us questions. And if anyone watches this after and would like to put more comments, that will be really helpful for us. And also, as Georgie said, any suggestions of what you would like us to do that might help you. And we're also talking about whether we might be able to do some online workshops possibly as well, so we can take a bit longer and go into a bit more depth as a possibility. But let us know what you would like. I don't know if you'd
Yeah.
like to say anything else before we say goodbye, Georgie.
No, just to take care, everyone, and who knows what next week is going to bring, but don't make any rapid changes. I think we need to just get used to it all, don't we? And
Take a
for our
breath.
children. Yeah, yeah,
Yes. So good night, everybody, and
yeah.
thank you so
Thank
much.
you. Bye.
Bye bye.